I would like to share this interesting story with you, please, and maybe it can speak to you as well. So I have a beautiful woman who reached out because she wants to build her family and she wants to optimize her fertility. And she brings her husband along, asking her husband questions. This is what I heard from him. He's very much into health and wellness. He's utilizing HCG as well as testosterone replacement therapy. And then his wife reports to me, she says, well, his personality has changed and now he's very irritable, and also he is growing his breasts as well. He's very difficult to reason with, and he's impossible to be next with him, and he also very emotional. What I heard was very specific, and again, it's very important to hear what people are telling you. Individual is on HCG as well as he's on very high testosterone therapy, testosterone replacement therapy. I, of course, asked them to do the blood work and do semen analysis. What we found in semen analysis was no semen, no sperm whatsoever, was no sperm. What could have caused that? Very high testosterone, exogenous testosterone, will suppress release of the sperm and production of the sperm. Very high doses of specific items that use not in tandem and that should not be used together, gonna have complete opposite effect. So what did I do for this patient? Firstly, stopped all of these things. We wanted to clear testosterone out of the system. Yes, blood work was done, testosterone is high as well as estradiol is high, as well as all signs and symptoms of increased prostate. So now we have to deal with so much more. And to let you know, everything in the body works together, and we know that the liver is very heavily involved as well. So we needed to get it all out of his system. We used IV nutritional therapies, cleaning his system and cleaning his liver as much as possible, balancing everything off, plus correcting his adrenal system as well, and reestablishing communication from the brain to his testicles. This is very important. So when testosterone, exogenous testosterone, is very high, signaling from the brain to testicles will say shut down because we have too much. That includes production of the sperm. So now we are about 6 months into the program and everything has been reversed to its normal function. We had sent this patient for semen analysis, and now he has 20 million semen sperm count to 1 milliliter. Of course, the norm is 40, but we're only doing it for 6 months. So this is an example of, just to let you know, that all of these effects are reversible if they're done right. So again, if you're somebody who wants to build your family, please take proper steps forward. Don't do something that will take you back. I'll talk to you soon.